The first question is, can a child's mental state affect their physical health? And I think the answer is absolutely yes. In terms of the way that they take care of themselves or a part of their treatment and how engaged they are with their doctors and treatment team, it does have a big impact. So for example, a child who's diabetic who needs to check their blood sugar several times a day and then administer insulin or change what they eat at the next meal is going to be less likely to do that if they're struggling with an emotional difficulty or mental health issue. A child who's depressed is much more likely to have greater anxiety and distress around pain and upcoming procedures or transitions. Certainly kids who are depressed also are more withdrawn, so even if they're having any of their own concerns, they often can't advocate for their needs and wishes. And so certainly mental health issues can play a role in all of these different facets of treatment. Now the second question is about, can kids really recover or get better even while they're still feeling ill or dealing with illness? And I think that answer is also absolutely yes. And we just talked about how kids are incredibly resilient. You know, there's so many things that a child who's dealing with medical illness has to face at such a young age. And more often than not, we see kids who are coping positively and really developing strength and adaptive tools that will help them throughout their lives. There's a concept in resilience literature that talks about the transformative powers of having to face adversity, and I see that time and time again in the hospital and in my practice, where kids who are having to face a diagnosis of cancer or some other sort of life-threatening or chronic illness really rises to that occasion and learns how to deal with difficult news, difficult procedures, difficult recovery courses, and ends up much stronger on the other end.